I want to be as informal, so if anybody has any questions or I'm being too outrageous or not outrageous enough, whatever, please do interrupt me. I want to start with a quotation from William Osler, who was an English clinician about 1905, 1910, and this was a phrase that I picked up in my medical training. Listen to the patient, he's telling you the diagnosis. Not many clinicians do. I suppose I have to bring that up today and say, listen to the client, she or he is telling you what's gone wrong. That's the way I would interpret that. Listen to the patient. That's the key, I think, to understanding this very difficult area. My background is that I did 4 years in psychiatry, 2 of which were in New York State, and then I moved into general practice 21 years ago in order to study family functions and family emotions, because that was where I thought that the major emotional problems were. And my researches took a great step forward 2 years ago when one of the 3 people on the clips described what happened to her. I'll get onto that in a bit. I'd like to remind you of a conversation we all heard yesterday on the television, on the video. I think it was Jim, can't remember whether it was Jim or not. He said, "All mothers are pains," he said. And then the voiceover said, "Some mothers are pains." And then Jim says, "All mothers are pains." So that seemed to go on for a while. And the television announcer said that this voice, or this person, Legion, I think was his name, was telling us what was wrong, and I believe this to be the case. I think that the person you saw there was correct. Not necessarily that all mothers are pains, but that his mother was not painful in my view, but the conclusion I've come to is terror. The consequence of child abuse, in my experience, is one of terror on the part of the child. If you regard the child as a unit there, the child knows that the outside world is very frightening. The child also knows that the parents are a barrier between him or herself and survival. I see this in terms of survival because this is what the patient is telling me. The parents are the only bulwark, the only defense against survival. Now, if a parent or an adult in charge of the child is a source of threat, then the child has no recourse. The only recourse the child has is to say, "This is not happening to me." And this works reasonably well in childhood. The problem is, they get into adult life, and they cannot then say, "This has stopped happening to me." And what I find, to my astonishment, and I would never have come to this without a great deal of support, both from the patient and the feedback I got, the part of the individual patient is too terrified to grow up. So they stay at the age of 4, at the age of 6, or whenever the overwhelming trauma occurred. There are 3 clips, and as I mentioned before, there are transcripts of the conversation because the accent is sometimes a bit difficult to follow. And I'm going to start with the first case. She is a 32-year-old woman who presented with, this is just the background, presented with various psychosomatic symptoms which I traced fairly rapidly to fear of her father visiting later that week. Now, having just returned from 2 conferences that I attended prior to my visit to the United States, in parenthesis, I am on a 10-week tour around the United States studying provisions for child abuse by communities and also trying to elicit interest and comments on my approach. They told me in this conference that general practitioners and other clinicians never said, "Were you sexually abused as a child?" So here she was telling me symptoms which I had linked immediately to fear of her father, and I was quite satisfied with that diagnosis and was going to proceed on that basis. I said to her as flat as I could, were you abused as a child? And she said yes. So I thought, now what do you do? So I said, well, how old were you when it started? So she said 4. So I said, well, I have a special clinic on a Wednesday morning. Would you like to attend, and we'll see if we can explore some of the emotions. So here she is.
And you go, the adult, to defend yourself, but you didn't know that when you were young. So when you're a little girl, your remedy is run away. And that's what you're still doing, I think. Is that right?
Yeah.
Is that what you're doing?
Yeah.
Put that in your own words, what I'm saying.
Oh, when I was younger, every step, because it wasn't every day, but if ever he started doing things like that, I'd just run away from home. And then I kept finding either be took back home or put away for another few weeks or a few months and then brought back again, hoping that everything would be okay. But it never was. And then I got married, and he still carried on doing it. I told my husband, but he was scared of him, so he wouldn't say nothing to him. And I think I must have had about 6 different addresses since then.
You never told him to get lost, did you?
No, I tried to talk to him, tried to say to him, what you're wrong with doing it because you're drunk or you don't really mean what you're saying and things like that. I wouldn't never say anything like that.
But you can say that to the Norman. You
Oh,
don't.
yeah.
So what's the difference?
Because he really would.
Well, you're more frightened of him than you need to be. I'm not saying you don't need to be a bit frightened, but you see what I'm saying? What am I saying to you about your stepfather?
But there are people there now who can
Well,
follow.
you're an adult now. But you don't think of yourself as an adult with respect to your stepfather, do you? What do you think of yourself as?
I don't know, it's as if he's got this sort of, I don't know if it was anybody else, if I was out and anybody started messing about like that, I mean, he'd get a crack or he'd, you know, put them in place or something, but with him it's,
Go on.
I just freeze, it's
Go on. So what's the freezing coming from? He's in charge, you see. And he's not, but you put him in charge. You put yourself and a 4-year-old. Is that right or wrong?
Mm.
You do, don't you? Does that make sense to you?
well, it shouldn't be, but it
No.
does.
So describe to me what I've just said. What happens to you?
That I feel young again, I feel,
Small.
yeah, easy.
Wicked, isn't it? And that's what you have to look at. That's what you have to get out and push on the table. Hello, stepfather, I'm a 4-year-old. You tell him, don't you?
Must be,
Can you see yourself doing that? Does that make sense?
yeah.
That's what happens, isn't it? If anybody else starts messing about, you stop them. Because you're in charge and you know what's going on. Stepfather's different. Why?
I don't know.
What did we just talk about?
We're being frightened of it.
And you're a 4-year-old. That's the snag, you see. You're a 4-year-old when your stepfather starts it. Does that make sense to you? What do you think about that? What do you think of that? Does that explain why you're frightened of stuff? How does it explain? starts messing you about, what do you do?
That'd be different, that'd be easy to cope with.
Right. So why is this difficult to cope with?
Because I'm frightened.
Yes, and why are you so frightened of it?
Because I know what I can do.
And also?
Because he's done it when, when he was younger.
Yeah. And so in a sense you're still younger. You tell him, I'm a 4-year-old. You think of yourself as a 4-year-old with him. Is that right or wrong?
Yeah, I try and talk him out of it.
Don't tell him to piss off. Which you could do if you put your mind to it. Is that right or wrong?
Yeah, that's right.
So why don't you tell him to piss off?
Because I'm scared.
You're a 4-year-old, that's fine. Do you accept that? I mean, am I making that up?
No, it's right.
So what's right?
I'm acting as a child police.
And why are you doing that?
I'm hurting back to Anthony's work.
Right. He's terrified you and your father before him. So they've frozen you at 4. Your emotions stop. Everywhere else is fine. Get off. Splat. You.
So that's the first one. I should have pointed out to you to notice that when I say, why don't you tell him to get lost, she gives what she is her standard reply, well, I told him he was drunk, and then suddenly it hits her what I've said, and she jerks, and terror comes into her face. She describes the fear, she describes the terror. Earlier on in the proceedings, she had said to me, that he would kill her, there's no doubt about that, but he would also kill her for telling me what was going on. Now that's my operative line, it's terror, and as far as I'm concerned, in order to disrupt normal rational thought, you have to have a really powerful mental force, a real powerful emotion, and terror is what does that. I tell my patients frequently that they are behaving as if they're suspended over a rocky chasm 200 or so feet below, and they're between 2 enormous parental fingers, and if they breathe the wrong way or think the wrong way, those fingers will open and that will be the end. And they are prepared to do literally anything. Yesterday, in the excellent workshop that we had on child abuse and adult victims thereof, we had a description of a satanic cult. Now, I'm not familiar with this. We haven't got many of those in England, at least not to my knowledge. But I can fully understand the forces and emotions which drive that sort of system, because I have talked to people whose mental processes have been totally distorted. They're like victims of the mafia. They have been made offers they cannot refuse. Now, I open the terror, in a way that my psychoanalytic training, such as it was, would consider anathema. But I call it emotional education. I tell them I'm looking for terrors. I asked one of the patients what I was doing, because I always ask for feedback, as you'll see in the next one. And she said that what I was doing was looking for unreasonable fears of her mother in that case. Now that's precisely what I'm doing. And I am suggesting to them that there is terror there. I do it in a conversational way, I do it in a persuasive way, but there's no point me knowing and them not, but I'm out to demonstrate to them that the thing which is interrupting their normal thought processes is terror. And if I can get them to see that, then I immediately say, what is your defense against this terror? And as she said right at the beginning, in the run-up, she runs away. And this is what people do. They deny, they run away, they cease to exist in a series of ways which they devise, and I say, okay, but what's a better remedy? And the better remedy is to be an adult. Now, simply saying the words, hello Dad, or hello Mum, I'm an adult, they just cannot do. Now, what I want to move on to now is the next clip. This is a 40-year-old whom I saw only on 3 occasions. So far, she's my star patient. I saw her on 3 occasions. The first hour, I didn't videotape her because I was undecided as to whether I'd be in a position to offer her treatment, because I was booked to come to the States and there wasn't a great deal of time. So I said, well, I will only undertake to see you on one occasion to try and sort out your problem. The history is that in 1970, her father died, she had a first child, and her husband died, all within a matter of months. Within a week of her father's death, she developed panic attacks. Let's see. So, the first 2 minutes where she's in black, you won't have any difficulties distinguishing the clips, hasn't been transcribed because a glitch got into my audio tape system. So you'll just have to do the best you can with that. Basically what's happening is that I'm asking her how she feels, what's happened to the symptoms roughly. I'm not particularly interested in the symptoms, I'm interested in the progress she's making along the lines that I'm prescribing for her, and what does she think about her parents. So this is probably just the tail end of the one before. There we go.
I'm still getting the panic attacks.
So what do you recall about last week that you talked about?
Not a lot.
Okay, what's 69?
You're saying that it was abused childhood and that I was frightened of my father. And it's as if he'd stopped me from growing up.
Right, do you think that's true?
I don't know, to be honest.
Are you frightened of your father?
I can't understand how you can be frightened of somebody who's dead.
Not the easiest way it's possible to do it. I mean, lots of people would do it. And how did he stop you growing up, do you think?
I don't know.
So what are your feelings about your father, would you say?
Well, both my mother and my father now I resent them.
Yeah.
Yeah.
Does that surprise you? What do you resent them about?
They held me back in every way. They were just for my two brothers and not me.
It's true, isn't it? And do you think you're frightened of them now, or what?
I don't think so.
You could be.
I can't understand how you can be frightened of somebody who's dead.
So where do these panic feelings come from?
I don't know. Well, they're terrible.
Then they come from your father.
I don't know, is that possible?
They've got to come from somewhere, right? The panic feelings are real, aren't they?
Oh, yeah.
Right, there's no doubt about that. Right. So they don't come out of the blue, they have to come from somebody. You're frightened of somebody. Right? Now, we discussed last time, you're being frightened of your father. And I think that's what's the bottom of it.
This is 2 weeks later, I think.
Now, hang about, don't mess about, because I'm an adult. Well, you couldn't have said that before because you're dead.
No. I really did fear him, but now I realise there's nothing to fear. It can't hurt me anymore. I've got a barrier up now and I just can't be hurt anymore.
What's the barrier?
It's not my kids, it's just something inside me. You're not getting in and niggling at me anymore.
What is it, this barrier?
Well, feels like that's how you feel. I don't know. I'm just numb to it. I'm numb to the thought of him and numb to the memory of him. Does that make sense?
Well, yes, it does, but I prefer something like you're an adult and you can tell him that. What I want to do is bring him down to your size. Right? Because he hasn't been your size, has he?
He's been a lot bigger than me for years.
See what I'm saying?
Yeah.
Hasn't he? He's been enormous. Right? And I want to bring him down like another human being. Which he is, that's all he ever was. If you happen to be your father, you were very much smaller than him at the time.
Seemed like a giant at the time.
And he seemed like a giant up till recently. Hasn't he? Is he still a giant?
No. No.
So when did he stop being a giant?
I think the last time I came, and when I went home, I really analysed things. I couldn't stop thinking. I know it probably sounds wrong, but I just couldn't stop thinking. I was analysing everything.
The first time, I say.
Yeah. And then the more I analysed, the more I went calmer, I thought, no, you're not doing it no more. And I have been a hell of a lot calmer, haven't I?
Has she?
Yeah.
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 See, if you're running through life and a giant's around going to knock you off, then you're in trouble. Which is what your position was. You couldn't see it and you didn't know anything about it, but that's how you were behaving. You were behaving as a giant there that was going to eat you. No problem. Squash you, just walking over you or whatever.
It's awful to think that it's happened though, isn't it? I mean, there must be a lot more kids a lot worse off than what I was, but what they must be going to go through in their life, I don't know, but yeah, it really goes out to them. I mean, I used to say, when I married Bill, I used to say, oh, you'd have loved me, Dad, if you'd have met him. But now it's an all different ball game, you know. I'm saying if you hadn't met him, you'd have probably seen through him before I did.
Amazing, isn't it? Fancy telling him that?
I did, but now I've took it back. And I've also talked to my kids about it, especially my eldest daughter. And she said, well, how can you blame my granddad? I said, he's dead. I said, you're dead. Dad is dead. He's not dead in your mind, and my dad wasn't dead in my mind, in the subconscious mind. You know, I've talked to everybody about it, and it's done with the world of good.
It does, isn't it?
Mm.
You really opened your eyes to it.
Yeah.
Did your father ever sexually abuse you?
No. Not that I can remember, no.
There's nothing like that?
No.
I mean, that's in the news now, a lot, as you know.
Yeah.
And I think it's more the fear and the violence that I'm going for.
Mm.
I mean, that's what I see it be. That's why I didn't mention sex abuse to you, because I don't think it's that important. I think it's the fear.
Yeah.
And then the people I've talked about, it's the fear with over and above the sex abuse.
Mm.
I mean, your father was a giant. He was a murderous giant.
Yeah.
Lethal.
He always seemed a lot bigger than me anyway. Although he was only small, he always seemed a lot bigger than me and more powerful. But I'm as powerful as him now, more powerful.
He's bigger?
Yeah. Because I've got more sense than what he had. I'd never frightened my kids to the extent he frightened me. I mean, for 17 years I've been struggling with this. I've seen umpteen psychiatrists and not one of them's hit the nail on the head.
So how would you describe to them what we've talked about and what's made a difference to you?
Well, I found out the cause of it, haven't I?
Oh, what is-
One thing.
what is it?
It's my dad, the fear that I had of my dad and growing up that he was still there and I was still frightened of him.
He was fixed, wasn't he?
Oh, definitely.
So how have you managed to get rid of it?
I talked him out of my system.
Yeah.
That might sound silly, but I have.
That
I
sounds
talked him out. I mean, the last time I came, we went home and we did have a little chat, didn't we? And then all night and all the day after, because I do analyse things, but I would have never come to this conclusion.
Do you know why you would never have come? Why would you never come to this conclusion?
I suppose because you're an outsider and you could see it.
So why would you never have come to it?
Well, I never would have thought it was my dad.
You wouldn't have started that, would you?
No.
You'd be looking in the wrong direction all the
Yeah.
time. Yeah, haven't you?
I have, yeah. I put it down to watching my dad die and watching my first husband die. I put it down to them. But it's not. It goes further, a lot further back than that.
Certainly not.
I can see it now. But when you first suggested it, I couldn't believe it.
You couldn't?
No.
So what was your reaction when I first suggested it?
I was shocked.
Yeah.
Mm.
What did you think? What did you think about it? The suggestion?
Well, it's like I said, I thought he loved me most.
So why did you give it further thought then?
Because there had to be a reason. And the more I thought about it, well, I linked things up, like you said, and try and link things up. I mean, like now, I can lie down when I go to bed now, and if water comes into my mind, it no longer frightens me.
Okay.
You know, and if I've got a butterfly in my stomach, I say, oh no you don't, you've done it long enough. You know, the end's enough's enough kind of thing. And you know, for a long time I would have thought of water when I went to bed, I would have had to get up. Or even looking.
There are 2 points I want to make there. First, her denial. She never would have come to this conclusion because she was convinced that her father loved her most. Now, there's a comment I want to make about that, because what I found is that some of these patients have an additional attachment, if I can put it that way, to the abusing parent or the feared parent, the terrorizing parent, and it seems to work on the basis that if you stick close to them, you can watch where the next attack is going to come from. So that, as she revealed, I mean, I wanted to show you the first 2 minutes of the beginning of the second hour to show you what her standard pattern was, because when you see her, the second clip, that's the third hour, she's talking freely, and in my view, she's understood where her panic attacks come from, and in my view, they will not return. The other 2 points I want to make, first of all, is the umpteen psychiatrist she saw. Now, what I think is going on there, apart from the appalling education of psychiatrists, is denial on the part of the therapist. There will be very few therapists who will have the confidence to say, you are terrified. The person is sitting there, they've got problems which have brought them to you, and they are already in difficulties. And I overstepped several very sensible boundaries by saying, you are terrified. I feel I was justified in doing that because I think by discussing the terror, and where I can in showing that how the terror prevents maturation or prevents them being an adult, that I think is the way through. And I also believe that there are certain emotional problems like this which, if you do not go through that process, then they will not disappear. That patient is particularly good at giving a clear description of what went wrong. My view is that these things are incredibly simple. They are not confusing, they are not arcane and exotic as Freud would have us to believe. As an aside on Freud, which I can't resist to begin, though I said I wouldn't, I think that Freud was terrified of his own father. I think that much of his theory and his pronouncements are based on that and covering that up. But I don't want to get sidetracked on that, except to say that the terror can very subtly distort the mind of the therapist. I will freely admit that prior to treating this next patient who's coming up now, not this clip 2 years ago, I had fears of my own father, not of a sexual nature that I can recall, not of any physical threat. I was just thinking about discipline then. But no single instant that I could put my finger on, but I'm quite confident that had I not had the confidence to confront and overcome that terror in myself, I would not have allowed this particular patient to describe what happened, as I will tell you just before we start. And without my having that confidence to say, I am going to talk about terror, the terror does not frighten me anymore, in brackets, then we would not have got there. Just one final point on this panic attack lady. I am also quite confident that here we have a well-structured, very solid member of the community. She says she's now going back to work, and her chosen occupation is elderly assistant to elderly old people's homes, something like that. And you can see that she'd be ideal for that job. She's a very solid person. She had very, very violent emotions, which caused her, I don't know her full psychiatric history, I haven't checked the hospital record because I only saw on these 3 occasions. But those were very severe, as you can see the way she described it. Now I postulate that had she been a man, had she been in a less socially structured situation, then I don't know where those emotions might have taken him. And I think that it's precisely that volcanic emotion which will lead to a lot of the horrific outbursts that we hear about. So now I move on to the final clip. This is a lady who is 40 years old. I must have known her on and off 10, 12 years in my capacity as a general practitioner, and I will have treated her for blood pressure, certainly, back pain, this sort of thing. About, I think it was 4 years ago, perhaps 3, she was coming on a trip to the United States, just 3 weeks, and she was seen by the practice nurse, who found that her blood pressure was rather alarmingly high, and so I was called in to advise on medication prior to flight. Now, I knew her, as I say, on and off over the years, so I said to her, well, we'll increase the medication, so on and so forth, and by the way, when you come back, why don't you fix in appointments with me an hour or so on a Wednesday, and we'll see if we can't uncover some of these emotions which are underlying your weight and your blood pressure. Now, I've always been interested in pursuing that sort of presentation of what I regard as emotional disease, and she agreed, and we proceeded for a number of weeks, up until I think it was session 33, when she described to me what I'm now going to tell you. And this was the turning point. This is September '86. She described how at the age of 6, her mother took her upstairs into the bedroom with her younger siblings. Her mother shut the door and pushed the furniture up against the door, because outside the door her father had an axe or a hatchet, and he was making holes in the door panels, and the axe blade was coming through, and he was saying, "I'll bloody kill you all." Now, he was drunk and eventually collapsed, and she was sent to run for the uncle and so on and so forth. Now, obviously I'd asked her about her childhood, and I'd asked her about the parental influences and her feelings about her parents, and this incident came out more clearly on this occasion, September '86, partly because she was feeling more confident, and obviously partly in retrospect because I was. And I then went, as you do every once in a lifetime, and I said, "You're frightened of your father killing you today." Now, her father had been dead 4 years, and it's an outrageous thing to say to any human being, but I was confident enough to say it, and then she dissembled and shifted in a manner which I could easily recognize, and so having adjusted to that myself, I then tried it on everybody else who came through the door, and I'm quite sure that that is what is happening. This is the terror which is paralyzing it, and she is a very, shall we say, articulate patient, a very slippery patient, and I'm get a bit irritated because you can see I'm trying to persuade her to say that she is expecting a hatchet. She hadn't seen me regularly over these 4 years, and I don't think I'd seen her for about 12 months. And she came, made an appointment about 3 months ago, and I saw her on about 3 or 4 occasions, because she had subsequently left her husband of 20-odd years, something she'd been wanting to do, except her father approved of her husband, and she didn't want to go against her father, even though her father had been dead 4 years. She then left her husband and was establishing her independent emotional and social life. But the problem was that when she met men in a social setting, that was fine. She would joke, and she was confident and witty and so on, which she is. However, in a one-to-one situation, she went to pieces, and she wanted help on that. She says earlier in the interview, it's not what you want, it's what they want. So let's take it up there.
Get in there, pal! He's got his hat, you can't see it at the moment, but it's clever, it's whatever, you know. What you have to do is to face a situation where the worst possible thing can happen, i.e. he picks up a hatchet and gets drunk or whatever, and you have to continue.
We don't know.
What? You see what I'm trying to do?
I'll be the one with the hatchet.
You see what I'm trying to do? What am I trying to do?
To make me see what's happening.
Yeah, what have you got to do in the situation when you see what's happening?
Is to see it isn't there. It really isn't there.
No, and if it was, what would you do?
Well, immediately I would defend myself.
How?
no, because I imagine myself in that situation. Where it would literally happen.
What are we talking about now? What would literally happen?
Anything.
Anything bad?
Actually.
Actually, yes. You imagine yourself in that situation, and what would you do?
I'm a big girl, I think I'd like them to kill me.
Yeah. But do you believe that you can stand up for yourself in that context?
Yes.
You've doubted it. It's not what I want, it's what they want. You go in there and you switch it to 6-year-old mode, because 6-year-olds were safer, in quotes, when you were a child. You thought, well, your father's done it once, but if you stay small, we had this before, you remember?
Yes.
Stay small, and he won't do it again. Don't grow up, don't mess about. So you go into a situation, one-to-one with a man, you say, stay small, don't mess about, don't grow up, he won't kill you. That's the message that you're giving out. Is that correct?
Not very logically.
Is that what's happening?
Well, something's happening.
Is that happening?
Yes, I guess so. Evidence would say so, yes.
So put in your own words what's happening. What have I just said? What happened?
I immediately revert back to being a 6-year-old then, somebody that can be used and controlled. I no longer have a mind of my own.
And what's the trigger for no longer having a mind of your own? What triggers it on?
Well, fear, obviously, I would have said lack of confidence
Fear.
on a one-to-one basis.
With a man. It's a man, isn't it?
Yeah, I know.
Yeah. So it's men who have hatchets, isn't it?
Yeah.
So what's your remedy against men with hatchets?
It's to be a caring little child.
And what's the better then? Can you see yourself doing that?
Stand up.
Can you see yourself that that's what's happening? Because that's crucially, you understand what's going on. It's not confidence, it's not your weight, it's not lack of experience, it's not such a
Fear.
Yeah. Fear of what?
Fear of a one-to-one relationship.
Good. Can you see that clearly?
Yes, I think so.
Right. And what is it fear of? What's going to happen in this one-to-one relationship?
It's control.
What's he going to do? What's the control about?
It'll keep me to a 6-year-old child if I allow it.
You set off by being a 6-year-old child. And then say, look what you've done to me. Don't you?
Yeah.
Can you see yourself doing that?
Yeah.
Good. Is that better, seeing it?
Does it help, you mean?
Yes, that's right.
Yes, knowing the problem, one can attempt to solve it.
One can't attempt too hard, of course. I mean, the chances are very small, aren't they? What?
The rascal, you see. Right. Yes, any questions or any comments you'd like to make at this stage? Perhaps I'll just make one or two comments that occurred to me. Very curious in this particular patient, I'm quite confident that even though she hasn't lost any weight, as you can see, I'm quite confident that that's on hold at the moment, that she now will, because we discussed either this session or one immediately preceding, that she would binge and she would gain weight in a non-dieting situation the day before or the day of a meeting that night with a man in a one-to-one situation. And she acknowledged this. We had a little game, several little games, but that was one of the games she had about diet pills. She said, give me some diet pills, I need them for a month, and she knows perfectly well that I no way that I've ever prescribed diet pills. But she understood why she hadn't in fact been losing weight. The other point that I wanted to make, not necessarily appropriate to her, but the main topic of this society, as it were, is traumatic stress, and you get stress situations in later life. And I'm quite confident that in traumatized individual adults, you need, or I would want to examine the childhood pattern to see if there was any antecedents and tackle them, because they are much nearer the survival patterns of the individual before also tackling the ones later in life. The story we heard, I think it was yesterday, there's so many horrible stories one's hearing, about the Vietnam vet who shot his victims in a particularly appalling way, which mimicked his experiences from his father. Now that, I think, is a pattern that I would look for in any traumatized individual, whatever the circumstances were. Going on from that, more positively, I think that there's a whole range of exercises that you could institute on a sort of, not a well woman clinic, but a well parent or a well adult clinic, where you could pull out these hidden terrors and combine them not so much sort of in self-assertion, but that's what it's about, because what happens is that when you're suspended over this parentally dominated cliff, as it were, you will do anything, including disappear. I've had a number of people who cease to exist, which is astonishing. The one patient introduced the concept of self-wipe. Somebody wipes you out, and just before they wipe you out, you wipe yourself out. So it's self-wipe. And this is sort of a rational, in quotes, remedy for a mortal threat. Just let me just complete this one. This obese lady said that by putting on or having the weight there, she eliminated herself from the competition, and in a sense she described herself as not existing because she was sort of invisible. That's another stunning. Sorry, you were wanting to say something.
I wanted to know what you meant by the wipe out. Did he kill himself?
No.
What do you mean by that?
Well, he meant to kill himself or cease to exist. It's a very odd phrase, but it was a woman actually, and she just preferred not to exist. It's sort of ultimate dissociation, you might say. She just didn't, talk about an ego, she had sort of a negative ego, if you want to put it in those terms. Not a multiple personality, but a zero personality. And this was a conscious strategy, which is developed in infancy or childhood, possibly in infancy, possibly in the first few months of life, and is adopted then as an entirely realistic method of survival. There's nothing you can do out there. You can float up, as you described very clearly yesterday, and you are dissociating, and this is the only remedy you have when you're this side or this side. The tragedy is that is carried over, in my view, lock, stock and barrel into adult life, where you disguise it very cleverly, as the last patient did. You can't see where the axe is, you can't see where the giant is, and you are just running on autopilot. You're not using your rational mind to uncover these things.
Do you see her then as using the binging to keep herself safe and distance from men? Do you also see that as anxious behavior and also as changing her biochemical structure so that she soothes herself and increases serotonin levels? There's some research talking about the use of carbohydrates to increase the serotonin level, which then soothes and improving her and so on.
I don't see it in those terms. I see it, as I say, a very stark strategy. The strategy is don't exist. If you're gross, then you won't get into a one-to-one situation with a man. This is the way I see it. And as I say, she gets gross and then is removed from the competition. Now she wants to get back into the competition. I say now she wants to get into a relationship with a man or with other people. So she's there in conflict, but the terror prevented her. I think it's the extra weight is a barrier.
Like that Vietnam vet, his father shot him and shot people in the same way. A lot of times kids who grow up in this kind of household, there is that urge to repeat the violent behavior. And she kept talking about, if I didn't submit, I might go after them with the axe. And I think it's real important. I think one of the things she may be the most afraid of is her own rage and her own violence. She brought that up repeatedly.
She brought, yes indeed she did.
About how angry and violent
yes.
she might, And you see this in a lot of abuse because if they ever do stop submitting, the only other response they do, in their family there was the half of people that submitted and powered in the room, and the only other role model is the guy coming through the door and react. I wonder if one of the things that she isn't afraid of that might happen in an intimate relationship is that she might end up being a violent person who reacts to domineering, rageful, bullying, and she looks like she's got enough force of personality.
Well, I think there's enough rage there to destroy harm.
And I think it might be very important to deal not only with her terror, but her rage.
Right,
and
right.
her fear of that.
Right, but what I do is I've gone through a whole lot of strategies, and what I do is to try and prioritize. And what I find is that particularly people like herself, who is very articulate, they will lead you on wild goose chases. And I'm not interested in pursuing the rage per se, because in my view, the rage, I mean, it's certainly there, I'm not doubting that, and the stories we hear about killing the spouse, murder and so on, I'm sure it comes from this sort of context. But my view is that the motivation is terror. It's a survival strategy for them. They will, she says she cowers as a 6-year-old. Now that is her standard emotional survival posture, regardless of her being a competent woman or a financial executive, which she is. And that is, to me, the priority. If she weren't able to overcome the terror, then the rage would be available, or might be available, if she got a little bit more confident. But by her having adult confidence, or confidence in her being an adult, then both the terror and the rage recede, in my experience. The way to pull the teeth out of the terror isn't to say, oh, you've got 56 pounds of steam pressure in there, let it out. That's not the way I think of dealing with rage or anger. It's, you take the heat out from under the boiler, and then it'll cool down, and it'll just disappear. I mean, the rage is there, as with the panic lady. The panic's just evaporated because her father shrank from being 20 feet tall to being slightly shorter than she was. And it's that sort of perception, I think, which governs the emotions.
I just wonder if there might be some modeling processes going on here.
I would accept this, certainly.
Strong, aggressive.
Yes, indeed. Yes,
very
indeed.
unlikely.
Well, he wasn't, you see. As before, he was a shrimp, according to her. And he was drunk. And that's, I mean, you can imagine a small, and making a big fuss and song and dance, basically. And he was, in fact, physically smaller than she was, most of her life. But it's the terror which is implanted when she was a third or quarter his size. That's, you see, the fascinating thing to me is that the development freezes. And it's a 6-year-old's emotions. They're alive today, but they shouldn't be. But they are. And they're just taken straight across. And when I'm dealing with this sort of person, or this sort of emotional problem, I like to keep the necks clear, because they're going to run all over the place. I first have to establish a good relationship with them, insofar as I can. And one of the troubles with this type of patient and this type of terror is that if you have any power and authority, then you're going to become a terrorizer if you're not careful. This is the one.
That might be what she's afraid of.
Well, this is why it takes a while, because she's not going to tell me these horrible things, because I shall wipe her out. But clearly we're making progress on that, and she's not as frightened of me wiping her out, nor does she regard me altogether as a man in the one-to-one situation. It occurred to me several times that we were in a one-to-one situation with a man. I didn't verbalize it. I showed this video earlier, and somebody said, oh, you should be dealing with this, that, and that. I'm concentrating on what I regard as the priority. If I don't make them look at the terror, I am wasting time, in my view. I've only got a limited amount of time, and I keep bringing them back. They'll float anywhere. They'll do anything, and you can understand why. I understand why, and I explain to them why. And I also explain that I want to get back to them.
I agree with everything. One
good point, and I do list 3 patients, and there are others that I could list there. Basically, I think they don't interfere with the prime model. I don't think you can fault a model which says a massive amount of terror delays development in this area, bring the patient up to adulthood, and the terror will evaporate. What you do get is the point that was partly raised here, that they are frightened of you. They're frightened of therapists, they're frightened of everybody, they're frightened of adults. Adults are people with power, and they don't want to be adults because their fathers will kill them, their mothers will kill them if they say, I'm an adult. So as they approach therapists, then they have this instant demolition as they come into therapy, so they're not going to unbend. And I've had 1 or 2 patients like this. I think you have to deploy all the tricks in the book, in particular the peer groups that we heard about yesterday, group work. I'd very much like to get into group work, but I can't do it in my particular circumstances. Any art therapy or whatever you can do, the storytelling yesterday was absolute magic, because you were telling us about sort of not any lateral discussion of it, but that's absolutely magic, and I respond very positive to that. You have to, I mean, I do this, I find myself doing this, then I say, and are you frightened of your father? And they say, no, 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 and I say, well, a lot of people are, and I tell them not exactly a story, but I'm telling them that I think it's so-and-so, and I'm discussing somebody slightly to the left of them, as it were, to block that off.
There's an implied attribution behind something you said that
I can, is that they are small. They are below the parapet. They have a low profile. They have a zilch profile. They have no ego. They're absolutely flat. I mean, when I say worm, they're a sort of subworm. And if they say, which is the only possible remedy, I am now an adult, Dad, or Mum, I am slightly bigger than you, or at least the same size, what are you going to do? Or then there's no contest. That's blocked. This is why I think the thing is perpetuated, because as they begin to say, I am an adult, they freeze, because the parental fingers are going to open and that's the end of it. I say it's only a 2-inch drop. I used to say that. I don't say that anymore, because it's the adult that they can't even...
Are you sure?
Yes, that's what I'm saying. They get frozen in the infantile position, the dependent position. Where,
the animal responsive position.
well, I don't think it's as sophisticated as that. I think it's just that the child, the 6-year-old or the 4-year-old, whatever, that's where they are. They don't know any better. They don't know why they're still alive. They're quite convinced, as the last 2 patients told me, that they were going to be killed, even though the one with the panics, her father would be dead 17 years. She is convinced her father is going to kill her. She isn't now, but she was then.
Maybe it's because I work with a different patient group.
Rage is not permitted by Dad or Mum, and once it comes out, I mean, these people are all seeing. These parents get everywhere. You can't even think without them knowing what you're doing.
The folks I work with, they can stick with the anger part.
Right.
Okay, as long as it's just anger because they did this bad stuff to me, but there's no real emotional oomph behind it.
It's the terror. You have to go,
Yeah,
I would say, go down a bit further till you get to the terror.
I'm just wondering about this, because I agree with going with...
Wide range of things that I could address. I prioritise and I deal with terror. I find it difficult enough to get her to talk about hatchets. I find it difficult enough to get her to say, I'm frightened, the man's got a hatchet, he'll hit me with the hatchet and I am helpless against him. Now that's my objective. She will...
But you're the man as well.
No, that's I'm not in that role with her, and this again is the difference from the Freudian transference. I don't accept transferred parental feelings. I'm in there as an adult to an adult. Right? That's what I'm doing. Yeah, that's what I'm. Since we've got half a minute over time, I'd like to quote from Karen Augusta's chapter, which, and to say thank you very much for yesterday's thing. There were 3 cases, or 3 comments in this chapter, this book that we discussed yesterday. Here's Dixie, and she says, something died inside of me that day. Now, I think that's what I'm talking about. I used the word dead in one of the papers I submitted, and they sent it back to say, you're talking rubbish. Nothing dies in the child, but in fact something does die in the child. Then another one, Anna says, he still scares me to this day. Now that is absolutely right. And here, the relief of taking a first step is accompanied by an equally powerful emotion, terror. And I would want, in the next edition of this book, a section on dealing with terror.